Well, good morning. I'm Anita Huberman, CEO of the Surrey Board of Trade, and thank you for virtually attending the Surrey Digital Town Hall on COVID-19, and more specifically with WorkSafeBC. We heard about the industry sector guidelines that were released last week, really ensuring that businesses and organizations were opening with a consciousness of health and safety. I'd like to acknowledge that we are on the unceded territory of our Coast Salish people, specifically the Kwantlen, Katzie, Semiahmoo, and Tawasin First Nations. I'd like to thank the Port of Vancouver and the Trans Mountain Corporation for sponsoring this morning's Digital Town Hall event. And just a little bit about our sponsors. Trans Mountain is a proud sponsor of the Surrey Board of Trade for numerous events. They continue on their uninterrupted safe operation of the Trans Mountain pipeline and construction of the expansion project, part of which runs through Surrey. Construction is underway at the Burnaby Terminal and Westridge Marine Terminal pump stations along the pipeline route, and pipeline construction in Alberta with more than 42 kilometers of pipe already in the ground. Next month, construction will begin in Kamloops, and construction right here in Surrey is anticipated to begin later this year, right near the Fraser River crossing near the Port Mann Bridge. And while we are in these challenging times, the Trans Mountain Corporation and its contractors are making every effort to ensure that their important work is conducted safely and responsibly, also contributing to our local economy as well as Canada's economy. And of course, the Port of Vancouver, they've been an ongoing sponsor of the Surrey Board of Trade Surrey Digital Town Hall Series. They are the largest port in Canada, trading with over 170 global economies. And just a huge shout out to our frontline workers. They are ensuring that we are getting the goods that we need from all over the world. They are our marine terminal operators, our truck drivers, our marine pilots, and our railroaders. Thank you so much to our sponsors. Just a couple of instructions and comments before we begin. The session is being recorded, so you can share the link with your colleagues and other contacts. The link will be sent to you after the session is over. And I ask you to start thinking and typing your questions right now in the chat function, because as soon as our WorkSafeBC representative speaks, we're going to go right to you, because we know even with the industry sector guidelines that were issued last week, there are going to be some gaps, some opportunities, some questions that you will have. So this time really is reserved for you. I also wanted to mention that the Surrey Board of Trade, I sit on the Premier's Economic Recovery Task Force for COVID-19, not only determining gaps and opportunities during the pandemic, but also opportunities post-pandemic. We also have a Surrey Economic Recovery Coalition, of which the Surrey Board of Trade, local BIAs and other chambers, and also the South Asian Business Association are a part of. Really meeting weekly with the City of Surrey Emergency Response Team, meeting with other stakeholders also to determine gaps and opportunities. And the Surrey Board of Trade has a direct line into the Prime Minister's office to do the same, identifying gaps and opportunities. So we're really encouraging our members and potential businesses also to become members of your Board of Trade right here in Surrey, because we are your concierge of connections, instigating change at the different levels of government to ensure that you get what you need. Now, let's turn it over to Chris Blackmore of WorkSafeBC. He is the Director of Industry and Labor Services. Sorry, Chris, back over to you.
Thanks, Anita. And thanks everyone else for joining today. So as I'm just starting up here, I'm going to try and share my screen. Hopefully we can bring this up to our PowerPoint. And let me know if you are unable to see that by typing in the chat, and we can get it sorted out. But I want to thank Anita for inviting myself to join you today. So I'm going to spend roughly about the next 30 minutes or so going through a PowerPoint that we've put together and delivered a number of times now around the province, and be able to hopefully provide you with some guidance on how to put together your COVID safety plan. So my name is Chris Back. I'm the Director of Consultation Education Services at WorkSafeBC. So Anita mentioned Industry and Labor Services, that we actually just changed our name a couple months ago. But essentially our team is responsible for the outreach work. So we work very closely with industry associations, labor organizations, health and safety associations, and really leverage those relationships to be able to promote health and safety. And since COVID really took shape within BC, at least in March, we've been pretty much all hands on deck, being able to provide support to industry as we move forward here. And I'm going to talk about some of how that support plays out a little bit later on in the presentation. So what I'm going to focus on today is essentially, every employer in this province is required to have a COVID safety plan, and that came through in a provincial order that was issued on Friday of last week. And that COVID safety plan is really in place to assess the risk of your exposure at the workplace and implement measures to keep your workers safe. So what I'm going to do today is I'll provide just a really high level understanding of COVID-19, as I'm sure most of you are aware of that already. Then we'll get into how to develop your COVID safety plan, and through that, really talk about controlling the risk of COVID exposure in the workplace. And really that is what your plan is centered around, is how do you control that risk for your workers. We'll then get into a little bit of industry information. I'll provide you a few examples. If we have time, I'll be able to maybe go right to our website and show you how we've structured some of the information on our website. Talk a little bit more about the support and other resources that are available both through WorkSafeBC and other organizations, and then we'll be able to open it up for question and answer after that. So let's jump right in and start off with a bit of an understanding of COVID-19. Many of you are probably likely familiar with what's on this slide already. We know that coronaviruses are a large family of viruses that can range in diseases from the common cold to more severe diseases. And COVID-19 is the name of this newly identified coronavirus, where we see symptoms very similar to the flu, such as fever, chills, new or worsening cough, shortness of breath, new muscle aches or headaches, sore throat. And we have seen that these symptoms can be mild to severe, and they can appear up to 14 days after exposure. And that's one of the tricky pieces about this is that 14 days after exposure and the potential that the disease can be spread before any symptoms are appearing within the body. So around transmission, we do know that transmission is through droplet in coming into contact with the eyes, nose, and mouth. And this is typically through close contact with people or touching contaminated surfaces. And what you'll see as we go through this, and why that's an important point, is we will talk very closely about the contact with other people, and the fact that 2 meters of distance is a real important piece to be considering as you're moving forward with developing your plan. So, and to build on that a little more, we know there's a number of factors that will increase the likelihood of transmission. That first one, again, being that close contact with other people. So if you have challenges within your workplace of maintaining 2 meters of distance between your workers or between workers and general public, then that can definitely increase the likelihood of transmission. And that's where you would want to be looking at what control measures you can put in place to minimize that likelihood. The high frequency of unique people in the workplace, and that just basically what we mean by unique people is just different people. So if you have, 5 people coming into your workplace during the day versus 100 people coming into your workplace during the day, so how many people from the public, and maybe some of you are not publicly facing and would have fewer people coming in. So the larger number of different people coming into the workplace increases the likelihood of transmission. Potential to work in enclosed areas. So we do know that working outside is better than working inside, but of course not everyone has that luxury. And when you are inside, larger spaces are better than enclosed spaces, just in terms of airflow and the ability to keep that 2 meters of distance from other people. So of course, people don't necessarily have control over the size of the workspace that they're working in, but these are things that can increase the likelihood of transmission and things you need to consider when you're developing your control measures. The potential for sustained group interaction, so how long are people engaging with each other? I think that one is fairly self-explanatory, as well as probability of infected persons. The higher probability of having infected persons, such in a setting like healthcare, obviously increases the likelihood of transmission, as well as inadequate self-isolation practices. So not having policies and practices in place around those who are experiencing signs and symptoms can increase that likelihood of transmission. And then the last point down there is around transmission via surface contact. So we do know that surface contact is not a high form of transmission. It is mostly around that direct contact with other people, but your regularly contacted surfaces like light switches and door handles and things like that are things that you'll want to pay attention to as you're putting your plan together. And just a quick slide on anyone that is experiencing flu-like symptoms associated with COVID should be immediately informing their supervisor, physically distancing from their colleagues and leaving the workplace, and then seeking medical advice if needed, either through 911 if it's an emergency, or through 811 for health advice, and then ensuring that you have clearance from your healthcare providers before returning to work. So again, these are things that I think most people are aware of. So let's dig into what I think is the most important part of this presentation, which is really around developing your COVID-19 safety plan in order to control the risk for exposure within the workplace. So employers are required, again, as per all employers in the province, as per the order that was issued on Friday, are required to develop a COVID safety plan that outlines the policies, the guidelines, and the procedures that you as the employer put in place in order to reduce the risk of COVID transmission. You do not need to have a formal plan in place to begin operation. So for those that have been closed down, you don't have to have your formal plan in place before you can begin operation, but you are expected to develop it while you are protecting the safety of your workers. So you do need to know how you're protecting the safety of your workers before you can open your doors, but to have the formal plan posted and in place is not necessary right away. The provincial health officer's order states that you must post a copy of your COVID-19 safety plan on your work site if you have one, on your website if you have one, or at your workplace, so that it is readily available for your workers, for other persons who may be attending the workplace to provide services, and for the general public. An important note, though, is you are not required to submit your plan to WorkSafeBC for approval before you can open your doors. So we are not approving plans at WorkSafeBC. I know there was some misperception of that. We do not need to approve those plans. However, if an officer does come by your workplace and does an inspection, you will be asked to provide them with a copy of that plan and expected to produce that plan. And if you're unable to, there is a possibility that an order could be written. So we have developed a template for you to develop that plan following 6 steps, which I am going to jump into in a moment. But the first thing, before we get into those 6 steps, I do want to talk about the orders and notices and the guidance. So the Public Health Office does have orders, notices, and guidance that are posted on the provincial government website. You do need to make sure that you're familiar with those, so you know what you are obligated to do from the provincial health perspective or from the government perspective. But there are many things that you can be doing to prevent the spread of COVID in your workplace. Physical distancing, again, just looking at the basics, physical distancing is really where we're going to focus most of our time on this and talking about that today. Cleaning and disinfecting is really important. There is a difference that I should mention between cleaning and disinfecting. So cleaning would be wiping away the visible soil from the surface, so whether it's dirt or dust or whatever it might be, and then disinfecting is following up after you have cleaned that surface with something that does have specific alcohol content to be able to clean that surface just using regular household cleaners or other sanitizers. So you do want to ensure, and this goes with your hands as well, you want to ensure that you are cleaning away the visible dirt that can be seen on your hands or on surfaces before you're disinfecting those surfaces. Personal hygiene, so covering your nose and mouth with a disposable tissue or the crease of your elbow when you sneeze or cough. Washing your hands, often with soap and water for at least 20 seconds. So using soap and water is the single most effective way to reduce the spread of the infection. If soap and water aren't available, then you can use alcohol-based hand rubs or hand sanitizers. But you need to ensure that your hands are clean before you use those hand sanitizers. So if they are visibly soiled, then the hand sanitizer will not work appropriately on your hands. You also want to ensure that you're not touching your face, eyes, nose, or mouth with unwashed hands, and not sharing any food, drinks, or utensils or other items in the workplace that might commonly be shared. So what does the 6-step plan actually look like? So the information on our website will help you to develop a plan. So we do have a template that's on our website. You can download that template and actually walk through the template. It is a fillable PDF. I'll show you a link to that in a bit, where you can go through the plan. And I'm going to walk through each of these steps and provide some more information as we're going along here. But just as a high-level overview, step 1 of that plan is to assess the risk at your workplace. Step 2 is implementing measures to reduce the risk. Step 3 is ensuring that you have policies and procedures in place to manage your workplace. Step 4 is developing the communication plans and training to ensure all of your workers and others that might be in your workplace are very aware of what your plan is. Step 5 is monitoring your workplace and updating your plans as needed. So many of you are probably familiar with that plan, do, check, act, occupational health and safety management type approach to this, where you do want to be regularly reviewing your plan, looking at where it's working, where it's not working, and implement changes. And then step 6 is assessing and addressing risk from resuming operations. So for those of you that have had your doors closed and you are now opening them back up, are you introducing some risks? Outside of just COVID, are you introducing some risks by opening your doors back up that you may need to turn your mind to before you can actually successfully do that? So let's walk through each of these steps. So step 1, you do need to ensure that you're continuing to assess the workplace for after operations resume. So assessing the workplace to identify where risk of transmission is introduced. So looking at all the tasks within the workplace, all the different activities that occur that your workers are conducting, and assess what that risk for transmission is associated with each of those tasks. You want to ensure you involve frontline workers, supervisors, joint committee, worker representatives in that conversation. I have a slide coming up on that in a moment, but very important that this is a joint effort, that you are including your workers as you are putting together your plan. And you want to consider questions like, where do people congregate? So where is the possibility of people coming together and not being able to maintain that 2 meters of distance? What job tasks or process require workers to come into close proximity with one another or members of the public? What tools or machinery or equipment do people come in contact with? And what, same thing with those tools and machinery, are they being shared amongst workers? And is there cleaning or sanitation activities that need to occur within those activities on a regular basis? And then also what surfaces are touched often. So again, earlier I mentioned, light switches and door handles and keyboards and other things like that you might have multiple people touching throughout the day. Now, I mentioned joint committees. This is probably one of the most important slides that I'm going to show you today, is involving your workers. There's a lot of fear related to COVID, and particularly for those businesses that have been closed down for a number of weeks now, and their workers have been at home. I mean, obviously the workers are looking forward to getting back to work and being able to maintain their livelihoods, but there's some fear. And one way to allay that fear is to ensure that you are including your workers in the conversation of putting your plan together. So if you have more than 20 or more workers within your work site, you are required to have a joint occupational health and safety committee. If you have between 9 and 19 workers, you are required to have a worker representative. And it is important that you are engaging with your joint committee, your worker representative, or if you have less than 9, then engaging with your workers in a structured manner to be able to identify and find solutions to workplace health and safety issues, include concerns about exposure to COVID, and ensure that there is a regular cadence of conversation. Now, joint committees are required to meet monthly. You may find that you need to meet more often than monthly at this particular point in time to be able to come up with a plan, your COVID safety plan, to be able to post to your work site. But it is extremely important that you are including your workers throughout this process. So then we go on to step 2. So you've done the assessment, you've looked at the risk that's within the workplace, And now you need to come up with your control measures. What protocols are you going to implement to reduce that risk? And really, again, we're focusing on maintaining physical distance. Where you're not able to maintain physical distance, then we can get into other controls. And I'm going to talk about that on the next slide, as well as having good cleaning and hygiene practices, good policies in place, which we'll get to in step 3, but really ensuring that you have thought through all the various protocols in order to reduce that risk. And we have a lot of information on our website, which can help you with this process as well. So this, again, is probably, I'd say, the most important slide that I'm going to show you today. And in our geeky safety world, this is what we refer to as the hierarchy of controls. And the hierarchy of controls is something that can guide you as the employer and the worker through choosing the most effective ways of removing the hazard and reducing the risk in the workplace. So specific to COVID, we talk about, and you'll notice over on the left-hand side, you've got that arrow with the consider first and consider as needed, is really we want to focus at the top of that pyramid to begin, the elimination piece, or I guess reverse pyramid. So the elimination piece. So how can we actually use policies and procedures to limit the number of people in your workplace at any one time, rearrange workspaces to reschedule work tasks to ensure that you're able to maintain that 2 meters between coworkers, customers, and others. If you are I guess, unable to maintain the physical distancing, or if you know there are certain tasks where you are potentially going to have close contact between people, then you do want to look at other levels of control. So we come now to the engineering controls, and this is the second level of protection. So if you can't always maintain physical distancing, then you want to look at things like installing plexiglass barriers or other ways of separating people physically from each other. So those control measures take place at the actual point of the risk, and you want to look at how you can engineer something, some sort of physical change to the workplace in order to minimize the contact between people. Your next level of protection after that, your third level of protection, is administrative controls, and this is where you're establishing rules and guidelines, such as posting occupancy limits for shared spaces, designating delivery areas, putting up posters, doing training education, having one-way arrows on the floor to create a flow through your work site. The challenge with these ones, and the reason why they're less effective than engineering controls or elimination, is because those administrative controls require behaviors of individuals. You can have all the policies and procedures in place that you want, but if you don't have your workers following those policies and procedures, then it may not be as effective as you want it to be. So administrative controls can be very effective, and in the case of physical distancing, we do require that, but we are looking at these being less effective than your engineering controls or your opportunities to eliminate or remove some of the job tasks from the workplace. And then that fourth level of protection is PPE, or personal protective equipment. So if the first 3 levels of protection aren't enough to control the risk, you want to consider the use of non-medical masks. In some industries, of course, we do require, such as healthcare, we do require specific personal protective equipment, but masks and gloves and other pieces of PPE are I'll say, the lowest level of protection and should not be the only control measures that you're putting in place. And interestingly, a lot of people jump straight to the PPE as being the way that they want to protect their workforce, but it really does not provide the level of protection that you may perceive from wearing a mask. And so we really want employers to be focusing on those higher levels of effectiveness within the control measures that they're putting together. So things you consider around, again, going back to the elimination piece around physically distancing, consider reducing the overall number of workers in the workplace, so limiting the number of people coming into your workplace. This may be done by implementing work from home schedules if you have the opportunity to do that, or rescheduling some of the work tasks. Ensuring that the appropriate number of people are in the area at the workplace to prevent workers from coming too close to one another or members of the public. So this may be done by posting occupancy limits, as I mentioned, on elevators or in washrooms or in other break locations or shared spaces. Maintaining a distance of 2 meters between workers and others where possible by revising work schedules, organizing work tasks, employing the use of dollies or other aids for work tasks that would typically be done by more than one person. Consider creating pods of workers or smaller groups of workers that work together. If you do require more than one worker to be in close contact with each other, try and create pods of workers that work regularly together, or implementing other measures that may ensure that workers can maintain the 2 meters of distancing. Where physical distancing cannot be maintained, you're going to want to look at separating people with partitions or plexiglass, as I mentioned, and then looking at the non-medical masks, as I talked about. So let's get into a couple specifics on this. And one thing that comes up a lot for us is travel of workers within vehicles that may be required within the type of work that's being done. So we do, as part of your control measures, you do, as the employer, want to limit essential work travel and ban non-essential travel if you can. But for instances where work travel is required, we do ask that you start considering practices on how you can encourage physical distancing between workers, and this can be challenging. So where you might typically fill up a vehicle and transport workers off to a work site, you may want to consider utilizing more trips with fewer people in the vehicle if possible. If you have access to different types of vehicles like buses or larger vans, that could be an option to spread people out. And where you are required or you are unable to implement those types of control measures and you are required to have more than one person in a vehicle, try and, if it's just two, try and sit them kitty corner to make them as far apart as possible. Or where you are unable to maintain that 2 meters of distance, then you do want to look at things like personal protective equipment and having masks available for the duration of that travel and minimizing the length of travel as best as you can. The other thing you want to consider is the cleaning and the hygiene. So having wash stations for workers before they get into the vehicle and when they're getting out of the vehicle, and it may be hand sanitizer if soap and water is not available, as well as doing a regular clean of the highly contacted surfaces within the vehicle, like the steering wheel or doorknobs, the shift knobs, the windows, things like that, particularly if your vehicle is being shared by multiple people in the driver's seat throughout the day or throughout the week. I do also want to talk about some specifics around cleaning and hygiene. So you want to ensure that you have enhanced cleaning and hygiene measures in place, providing adequate hand washing facilities on site for all workers and ensuring the location is visible and easily accessed. So developing policies around when workers must wash their hands, including when they arrive at work, before and after breaks, after handling cash or other materials, and before or after handling common tools and equipment. You also want to ensure that you're supplying the right equipment for your workers, and this would be things like soap and water, hand sanitizer, disinfecting wipes, nitrile gloves, and garbage bags for those that are taking care of the cleaning and the sanitizing, and so forth. Implementing and cleaning protocols for all common and highly contacted surfaces. Again, earlier I mentioned desks and light switches, but you might have equipment or tools that are touched by multiple people throughout the day regularly, things like that. Your washrooms, change rooms, things like those. And then removing any unnecessary tools or equipment that may elevate the risk of transmission. So this might be commonly shared things like coffee makers or shared utensils and plates, snack bins, open food trays. If you provided food within your work setting, you may want to consider not doing that at this point in time. And then incorporating end of shift wipe downs for all shared spaces. So more robust cleaning procedures at the end of the day. And then that last point there is just ensuring that you are taking the opportunity to train your workers on these new protocols, provide adequate supervision, and then document what those protocols are. And as has been mentioned, put that within the plan and ensure that that plan is posted and available to your workers and the general public. So once you've gotten through step 2 and you've created those control measures and you put those control measures in place, you do want to consider the policies that you're going to have to ensure that those control measures remain effective. And you do want to document policies on this and make it formal as best as you can. So this will include policies around who can be at the workplace. So you want to consider prohibiting visitors who show any signs or symptoms of the illness. You want to ensure that any of your workers who may show signs and symptoms are being sent home, as I mentioned earlier. You want to ensure that any workers working alone, in order to reduce the risk of transmission, that you have appropriate protocols in place for that. And again, using things like working from home and ensuring that, and I'll speak a bit about this towards the end of the presentation, speaking about what you're able to put in place in the home environment so that your policy for working at home, so that you are able to continue to provide that health and safety oversight to your workers. Once you're through step 3 of developing those policies, then it really comes down to the communication plan and the training. So as I said all along, we want to make sure you're including your workers throughout the process of developing that plan, but not necessarily your entire workforce is going to be involved in that. So you may have a select group through your joint committee or your worker health and safety representative to develop that plan. Once you've developed the plan, you need to communicate and ensure that you are effectively training your workers on how to implement, how to follow the policies and the procedures that have been put in place, what signage is going to be around the work site and what they need to be following, and then also ensuring that supervision is being provided by your supervisors throughout the workday. Step 5 is monitoring your workplace and updating the plan. So I mentioned the Plan, Do, Check, Act, updating your policies and procedures as needed. You know, once you implement, you might not get it perfect right off the bat. So once you've implemented, you want to look at what you can do in order to modify and continuously improve, and then ensure that your workers have an avenue to bring any issues that they have forward, any challenges that they're facing with implementing those control measures. And again, this can be done through your worker health and safety representatives or your joint occupational health and safety committee. And then step 6, as I mentioned, is kind of almost outside of the risk of COVID in a way, that particularly for those that are going to be opening up their doors who have been closed for a while, you may be introducing new risks or possibly need to remind your workers about the regular risks that are at the workplace outside of just COVID. You may have staff turnover, or you may have workers who have been required to change or adapt job roles or new equipment, so they're going to need some training on that. Consider training for new employee orientation. Will workers need time or training to refresh their skills if they've been off for 2 months on particular uses of equipment or the other things? Have you changed anything about the way that you operate in order to deal with COVID? And if so, how are you ensuring that, that the training is occurring there, and considering other products or things that you might be using? And are there any processes required for startup that might introduce risks? So machinery that's been closed down or shut down for a number of weeks, is there something you need to take into account by starting that machinery back up? And as I mentioned, there is a template on our website. So there's a link here. I'm not going to go to the website just for the interest of time at this point in time, but this PowerPoint will be sent out in PDF form to all the participants after today. The links throughout the PowerPoint are available to each of you. Click on those links, go to worksafebc.com. Right on our homepage, you'll see you can't miss it, you'll see the COVID link, which takes us to our main COVID page. And then under there, if you just click on returning to safe operation, which is phase 2, you will see the 6 steps right there and a link to the COVID safety plan. There's also links to the COVID safety plan throughout all of our materials as you're looking at your industry specific information as well. So what should workers do? It's also really important for workers to know their responsibilities. So yes, employers have responsibilities here, but so do workers. Workers also have 3 key rights. So the right to know about the hazards in the workplace, the right to participate in health and safety activities in the workplace, and the right to refuse unsafe work. And around the right to refuse unsafe work, employers, you do need to ensure that you understand your responsibilities here, that if a worker brings forward a refusal of unsafe work because they're not comfortable with what they're doing related to maybe control measures that you've put in place, you are obligated as the employer to do an investigation in that particular case and work with your workers in investigating and hopefully coming up with resolution. If through a number of steps you're unable to resolve that issue, then you can contact WorkSafeBC and we will step in and assist with that process. But you want to ensure that your workers are complying with the employer's instructions around minimizing exposure, practicing physical distancing, cleaning and disinfecting, and personal hygiene, and then taking any steps to minimize their exposure while they're outside of work as well, as per the guidelines from the provincial health office and the government. So industry-specific protocols. So we had developed a bunch of protocols, I'll say under what we call phase 1 or essential services. They're up on our website, and you'll see the list of industries over on the left-hand side of that screen. And then just on Friday, we launched the phase 2 industry resources, which you'll see on the right-hand side of the screen. So we have protocols that are put in place for all of these. Very easy to find on our website by just going to the location that I mentioned a moment ago. And what I had done here, and I thought we might have an opportunity to be able to go to the website and take a look, but I provided a couple of examples. I haven't gone through all of them, but this is a phase 1 example for manufacturing, which has continued to operate, where we have protocols around physical distancing, hygiene and cleaning, and washroom facilities. We get into small business, which of course spans phase 1 and phase 2, depending on which industry you're in. But we do have a specific page on small business to hopefully help small businesses understand COVID-19, who should be coming into the workplace, physical distancing, cleaning and hygiene, documentation and training, and so forth. Retail, you'll find, is in phase 1 and phase 2. So grocery, for example, we still have a lot of information for grocery stores under phase 1. And then phase 2 retail gets more so into those retail stores that may have closed down, like clothing stores or shoe stores, sporting goods stores, things like that. And we have protocols. So these are just sort of the high level, I'll say, sections within each page, but this gives you an idea under retail. We have protocols underneath each one of these. So store layout and customer occupancy limits, we've got a bunch of protocols listed underneath that you can use a bit of a drop down, and it'll show you what those are. Talking about assisting customers, fitting rooms, product delivery, all these types of things, and then restaurants and others as well. So I was hoping we might have time to go to it, but I don't think we do, because I'd like to be able to show you a few other slides before we get to the end here. And the first one is around psychological health and safety. So COVID has impacted everyone in every way that we live and we work, everything to do with our livelihoods, and that impacts people in different ways. It can affect people, increasing anxiety and stress, uncertainty about how this pandemic is going to impact them and what the future might hold. So it's really important to remember that mental health is just as important as physical health, and employers should take measures to support mental well-being and health for their workers. It is something you do need to consider. I mentioned earlier the fear of workers coming back to the workplace, and including them in that conversation is a huge step in being able to allay their fear and the stress and the anxiety. But this is something that you do need to pay attention to. There's a number of links here that will take you to various websites. This is all available on our website as well, but you can link through to these organizations that have tips and tools, different webinars or videos, posters that you can download and print, a series of recorded webinars on mental health and coping strategies and things like that. So please don't forget about the psychological health and safety of your workers as we're going through this. Just a couple more slides to go here. So for those that do have the opportunity to have some of their workers working from home, and I know not everyone does, then you do need to understand as the employer that your responsibilities for their health and safety still applies if they're in the home environment as much as it does in the work environment. So you need to ensure that you have a policy in place for working at home, and that policy includes the hazard and risk assessment at the at-home environment, procedures for working safely at home, including ergonomics, and I've got a slide on that in a moment, evacuation and emergency procedures, education and training, ensuring the worker understands their duties at home, reporting procedures, check-in procedures, things like that. Now, it doesn't mean the employer has to go out to the worker's home physically and do an assessment, but you do need to have a process in place. And so we do have some various resources on our website that we put within the COVID page that can help you through this process. Some checklist type approach to working with your worker virtually while they're at home, so they can do an inspection of their home environment and set up their work site as best as they possibly can to be able to continue to do the work and be productive in a safe environment at home. So that usually results in ergonomics of an office environment. And I really want to draw your attention here to the last link, the bottom of the slide, how to make your computer workstation fit you. This is an excellent resource that you can use to be able to help you through this process. Talks about the ergonomics in an office environment that your workers can focus on. So you as the employer should be familiar with that as well as your workers. Really focus on micro breaks throughout the day. So it's really easy to get up in the morning and sit down at your desk and not come up for a breath of air until dinner time, and that's just not healthy. We do recommend the 20-20-20 rule, which is every 20 minutes, take a 20-second stretch break and look at least 20 feet away from your screen in order to relax your eyes and stretch out your muscles. So these are things that you would want to pay attention to in the home office environment, and that resource down at the bottom is an excellent resource to be able to help you through this. So I've talked a lot about the resources that we have on our website. That there is just a picture of our home page. And you'll see in the bottom left-hand corner of that picture, the big sort of shaded blue area with a big virus picture. That you just click on that, and that'll take you directly to our COVID page with many links within it based on industry information. So lots to find there. If you can't find what you're looking for, then you can definitely contact us. And I'll draw your attention immediately to the bottom right-hand corner of this slide, in that we've got some phone numbers available for you with very quick turnaround. We're answering the call right now in an average of 30 seconds and providing full responses within an average of about an hour and a half to be able to answer your questions. So 604-276-3100 in the Lower Mainland, or 1-800-621-SAFE toll-free throughout BC. We do have officers. We have 300 officers in our organization, plus I've got about 25 people on my team. We are out there doing consultation and education with employers. So we are taking a consultative approach to our inspections. We are expecting that an employer has a plan in place. They are required to have one in place, and we are expecting that the employer will be able to produce that plan and show the officer if asked. But we really are taking a consultative approach, recognizing this is a new risk, a new challenge for lots of us. Really helping employers to understand where the risks might be, helping them to implement the control measures, and helping them understand what they need to do to put those plans in place. But if we do see that an employer is not doing their own due diligence and taking on the responsibility that they need to take on as the employer, then there is a possibility that orders are being written under Section 21 of our Act, which used to be Section 115, which is the general duties of an employer. So it is a possibility, but just so you know, we are taking a very consultative approach to this. So a couple more slides just on claims. I won't get into this one in detail. We do have a COVID claims FAQ site linked there at the bottom of the screen, but just to let you know, our claim services are operating as they have been. Full services are available, and that we are getting claims coming in or I should say reports for COVID-related claims in the workplace. The same test applies. It has to be demonstrated that that has occurred in the work site in the course of doing the worker's duties in order to be acceptable. And with this being a public transmission or community transmission situation, it is a fairly high test for that to be proven that it was in the workplace. But industries like healthcare, where they are being exposed to sick individuals on a daily basis, would be an example where claims would likely or could occur. So some additional resources, lots of resources out there for you through the BC Centre of Disease Control, Office of the Provincial Health Officer, HealthLink BC. We've also got some other resources through Small Business BC. I know the Surrey Board of Trade likely has lots of resources as well that are available to you. And then Canadian Centre for Occupational Health and Safety has developed lots of resources as well. So that brings me to the end of the PowerPoint. And I put a couple email addresses there. There's my email address if you have any specific questions for me with anything that I've said today. We've also got our consultation services at worksafebc.com email address that you can send questions into. But as I said, for the quickest response, those phone numbers that I showed you a little earlier are the way to go. Call our prevention information line, and they will be able to provide you with any questions that you might have very quickly. Very, very quick turnaround on that. So maybe with that, I'll hand it back over to Anita, and we can open it up for any questions that people might have. And I'll stop sharing my screen at this point, and I can bring up slides if needed.
Thank you so much, Chris. We'll go to audience questions now. What are the instructions for businesses in case we get a positive COVID-19 test result for an employee?
Yeah, good question. I've definitely gotten that question a number of times, and really, the instructions, I'll say, is to follow the direction of the Provincial Health Office. So the first and foremost, if anyone within your workplace, as I mentioned at the beginning, if anyone within the workplace has experienced signs and symptoms, they should be sent home and asked to follow up with their healthcare professional. If they do go through the test and they do have COVID, then you will want to follow the direction of the Provincial Health Office. So they are doing tracing, where they will track back anyone that or as best as they can, anyone that person has come into contact with over the course of the days leading up to the positive test. And if they will provide direction to the employer. So if it was a situation where there was really close contact, there is a possibility there will be recommendation for others within the workplace to be sent home as well. But we are really recommending that employers take the direction of the provincial health office. It'll be a case-by-case basis. There isn't a blanket policy on that, other than if anyone has signs or symptoms in the workplace, they should be sent home immediately and asked to follow up with their healthcare professional.
Chris, there seems to be some confusion about the plan that needs to be posted. Is it the 6-step checklist template that needs to be posted? And can you repeat where it needs to be posted?
Yeah, so this is the interesting thing about this is really the only responsibility for you as the employer is that you have a plan. You don't have to use our template. You don't have to necessarily use the 6 steps that we've come up with, but you do have to have a well thought out plan. We have provided as much information as we can on our website to help you with that. You can download that 6-step plan, and there's space on those pages to be able to type stuff right into it, the fillable PDF. So that's one opportunity, but there's not an expectation that you use our template. You can have your own template. You may have developed your own plan. It may just be, depending on your business, it may be a simple enough 8.5 by 11 piece of paper with some bullet points on what you're going to do. But you have to have demonstrated that you've gone through a thought process of creating that plan, and we recommend following those 6 steps to do that. Now, in terms of posting it, it does have to be available to your workers, any contractors or service providers that are coming into your workplace, and the general public. You can do that in a number of different ways. You can post it on your website if you have a website. You can send an email out to your staff. You can have it plastered to your front door if you want. It just has to be posted. So the provincial health order that came out on Friday doesn't dictate, doesn't really get prescriptive in where it has to be posted, as long as it is available to anyone that wants to see it.
What about visitors that are coming into a workplace? Do we ask them if they've had COVID? What are some protocols around that?
Yeah, Anita, I would recommend that, and you'll see that throughout some of the protocols on our website, that if you've got customers coming in on a regular basis, you would want to have policies in place on how you are going to handle customers that might be showing signs and symptoms. Or you may want to be asking questions right up front as they're coming in that front door. You may want to have someone stationed there behind a plexiglass shield or whatever, or a front desk, or however you're set up in that environment. And you may want to be asking questions right up front. Are you experiencing any signs and symptoms? And if they are, they shouldn't be allowed into the store. So you would want to be developing policies in place. And I know that makes it tricky because everyone wants that business coming into your work site. But the problem is if you don't have those policies in place, then you're creating risk for your workers, but you're also likely going to reduce the confidence of the rest of the public that wants to come in and use the business as well. So we do recommend through our protocols that you're asking questions and having policies in place that the general public, anyone who's shown signs and symptoms will not be allowed into the work site.
Is WorkSafeBC working with each industry association to develop a sector-specific strategy and tools?
So yes, so I showed you that list of phase 1 and phase 2. We have definitely been engaging with the industry associations within each of those sectors as we've been developing, also with labor. So we've worked very closely with labor organizations to get their input. But we, as there's probably lots of people on your call right now that will look at that list that I provided and said, okay, well, do I actually fit within one of those industries? And it is tricky. And let's use personal services as an example. Personal services, the scope of personal services, we talk about hairdressers and nail salons and barber shops and things like that all the time. But then we've been getting questions on, well, what about tattoo parlors and piercings and tanning salons and personal trainers and things like that. We're not necessarily going to be developing protocols down to that level of, I'll say, minutia with industries. But what I would recommend is that employers are going to our website and saying, okay, under personal services, I may not be a nail salon, which everyone is talking about, nail salons and hair salons, but I have direct contact with individuals. If I'm a tattoo parlor or I'm doing piercings, I have to touch that person in order to provide that service. So the protocols are going to be very similar to someone cutting hair or someone that is doing nails, the manicures and the other personal services like that. So I would recommend that employers are going onto our website, trying to find what might be closest to their industry, and then going from there. If you're not finding what you need or you have additional questions, contact us. As we continue through phase 2 and into phase 3, we are continuing to develop more resources. We've got camping coming up. We've got hotels and resorts. We've got film. We've got gyms and fitness facilities are going to be posted this week. We are constantly developing, and we will continue to develop. But of course, we only have a limited amount of capacity. So we are engaging with the industry associations as much as we can, or where there is one. In some cases, there aren't industry associations. And we're reaching out and getting input as best as we can as we develop the content.
When you're talking about barriers, Chris, do they need to be plexiglass or just barriers of some sort?
Yeah, good question. They don't have. I mean, it's difficult to get into a really prescriptive answer on something like this, only because it does depend on the task that's occurring and the work site. We talk about plexiglass because plexiglass, you can see through it. It provides a physical barrier, and it's something that can be cleaned very easily. So when you think about plexiglass, you know, many of you have probably gone into grocery stores and seen the plexiglass up between the cashier and the person that's buying their groceries. Well, that allows that visible contact between the two people. You can still talk, and it's easy to clean, so you can see people really easily. You could use other barriers, physical barriers for sure. That's not a problem. That wouldn't be an issue, but it does kind of depend on the situation. If it's a high traffic area, if you use something like canvas, maybe clear canvas or something like that, it's harder to clean. So you need to think about the cleaning and the disinfecting and how easy it's going to be in order to put those practices in place if they're high touch surfaces or surfaces that could come into contact with individuals. So it really does depend on the situation. It doesn't have to be plexiglass. We just use that as the example because it is probably the most versatile in this situation.
So this is going to incur a lot of cost for small businesses, all businesses actually. Is there financial support available for businesses to pay for these types of barriers and health and safety prevention pieces that are needed?
Not through WorkSafeBC. So we don't have funding available to employers to be able to purchase and implement the control measures that they're responsible to do that. I do understand that there may be other financial opportunities for small businesses through the provincial and federal governments, but I wouldn't really be one to speak to those in detail. But not through WorkSafeBC. We do not have funding available for employers for control measures.
Fair enough. We've addressed that topic at the Premier's Economic Recovery Task Force, so perhaps in the future. And the next question is around businesses that are handling paper. Is there a risk around COVID-19 in terms of handling paper? Should people be wearing gloves in that instance?
Yeah, good question. So one thing that, and I kind of spoke about this a little bit towards the beginning of the presentation, is that there's been lots of research. There was something that came out from the Journal of the New England Journal of Medicine a couple of weeks ago around how long the virus can live on certain services, and we've had lots of questions coming from clothing stores, for example, on after someone tries on a sweater, do we need to quarantine that sweater for 24 or 48 hours before we put it back out on the shelf? The same thing would apply to paper and to money. And I think if we look at this, we do not feel at this point in time, based on the research we've seen, that contact with surfaces is a high risk for transmission, particularly where those surfaces are not touched very frequently. So paper, again, the devil's in the details. So it kind of depends a little bit on the specific situation you might be talking about, but paper might not be touched that many times. And so the risk really isn't there. And as long as you have really good hygiene practices in place, you're trying not to touch your face as much as possible, washing your hands frequently, it shouldn't be too much of a concern. Now, we do recommend in a lot of our protocols to try and avoid using money or the handing of credit cards back and forth and use tap where possible. That is not always possible, particularly for low-income earners. They may not have credit cards. They may have to use cash. What we recommend is you're cleaning your hands regularly. You have sanitation in place. Maybe if you're in a a grocery store where we've got many checkout aisles. Maybe you have one aisle that's dedicated to cash and all the other ones only do credit card and debit or something along those lines. So you want to minimize the exposure as much as you can. We're not necessarily saying gloves are going to solve the problem, because even if you're wearing gloves, once you touch that paper, and if you touch your face with that glove afterwards, it's no different than using your hands. So you would need to be replacing the gloves on a regular basis, which isn't environmentally friendly, nor is it necessarily efficient. So you're better off having hand sanitizer or availability of soap and water and washing your hands frequently is really where we would go with that. And the question just, well, I mentioned it, coming back to quarantining clothing and stuff like that, we're not recommending that at this point in time, nor is the Provincial Health Office. We're not saying that that clothing should be quarantined for 24, 48 hours after it's been tried on. You know, we do recommend that the change rooms should be cleaned on a very regular basis, but we do not see the virus being really viable to the point where it is going to be a high likelihood of transmission through products that are not touched on a very regular basis. But again, things like light switches, door handles, keyboards, you know, things like that should be cleaned quite regularly throughout the day.
My last question to you is about working from home. And we're going to see a complete transition, I believe, in our workforce of more and more people working from home. So for employers, it's going to be very challenging to ensure that based upon WorkSafeBC principles and guidelines, that those measures are adhered to by the workforce, because it's hard to control what happens in a home. So any advice there in terms of lessening the burden for the employer?
It is tricky. It is tricky. And as I mentioned, you're, as an employer, you are responsible to ensure the health and safety of your workers in the home environment. And you know, specifically, and we've gotten this question quite a bit, is the employer now required to buy a chair or a desk or something along those lines for their worker? And we're not necessarily saying that. Again, unfortunately, this is one of those situations where it is on a case-by-case basis, and it really depends on that risk assessment, that hazard identification risk assessment that should be done jointly between the worker and the employer, which again, you don't have to be there face-to-face to do that. You can do that over the phone. But, excuse me, talking about what opportunities the person has at home for a chair or for you know, getting even using potentially a cardboard box or a stack of paper to put your computer on so that you're not you know, you don't have a poor posture of your neck. Looking at being creative within the workplace and working with your workers in order to set up your home office as best as you can. Now, the longer this goes on, the more of a risk that potentially becomes, but that's going to have to be sort of that ongoing assessment and check-in that the worker is going to need to do, or the employer is going to need to do with their workers who might be working from home. But it is your responsibility, and it's something that you do need to consider as the employer, in that if a worker is working at home and you've instructed them to work at home, because you know it's one of the control measures you put in place, and they are doing their work and they do experience an injury as a result of that, it still is considered a workplace injury, and assuming that claim is accepted, then the employer is going to be on the hook for that. So you do need to consider the measures that you're putting in place to make it safe for your workers to work from home. And there are many industries that have their workers working remotely, that are out, maybe not at home all the time, although there are lots of those as well, but lots of people that work remotely and aren't face-to-face with their employer throughout the day. And so having that appropriate supervision and that check-in, see how things are going, and really getting your workers, particularly in the home environment, if they start to experience any signs or symptoms of a musculoskeletal injury, whether it's a sore neck or a sore back, sore wrists, any sort of pain or inflammation, reporting that immediately, getting on top of it right away, and that might be the trigger for you as the employer to be doing more than you might be doing at that point in time. So it's a balance. You need to do the best you can, but it is your responsibility as the employer to ensure that they have a safe environment while they're working at home.
Well, everyone, WorkSafeBC is here for businesses. And I know there's going to be many more questions. There were questions in the chat function that we were unable to get to this morning. We'll respond to them afterwards. Chris, thank you so much for this valuable information. We're going to send the recording out far and wide to our expansive network through the Surrey Board of Trade. Thank you so much to the Port of Vancouver and the Trans Mountain Corporation for their sponsorship this morning. And ladies and gentlemen, let the Surrey Board of Trade know what you need. If there are gaps, if there are opportunities, email me. We're here for you.